How is lung cancer prognosis determined after diagnosis? When someone is diagnosed with lung cancer, understanding their outlook can seem complex. Prognosis, or the likely course of the disease, depends on many factors that doctors carefully evaluate after diagnosis. The most critical factor is the stage of the cancer, which describes how far the tumor has grown and spread. Doctors use a system called the TNM staging, which looks at the size of the tumor, whether it has spread to nearby lymph nodes, and if it has metastasized to other parts of the body. Early-stage lung cancers, which are confined to the lungs, tend to have better outcomes. For example, the 5-year survival rate for localized lung cancer can be around 60%, but if the cancer has spread to distant organs, that rate drops significantly, often below 10%. Beyond staging, a patient's overall health plays a big role. Performance status measures how well a person can carry out daily activities. Patients with good performance status generally have a better chance of responding well to treatment and living longer. Age also matters. Older patients might face more challenges with aggressive treatments like surgery or chemotherapy, which can influence prognosis. Additionally, symptoms at diagnosis, such as weight loss or coughing, can indicate more advanced disease and may be associated with a less favorable outlook. Patients who are diagnosed before symptoms develop often have a better chance of successful treatment. The health of the lungs and respiratory system is another important aspect. People with a history of smoking or other lung conditions may have a harder time tolerating certain treatments and may have a worse prognosis. The specific type of lung cancer also influences outcomes. Non-small cell lung cancer and small cell lung cancer are different in how they grow and respond to treatment. Advances in genetic testing have identified mutations like EGFR or ALK in some tumors, which can be targeted with specific therapies. These targeted treatments can sometimes improve survival and quality of life. Doctors also consider molecular and genetic features of the tumor. Researchers are studying biomarkers that can predict the risk of relapse after treatment, helping to tailor follow-up care. To bring all these factors together, clinicians often use prognostic models like the Lung Cancer Prognostic Index. This tool combines information such as stage, tumor type, genetic mutations, performance status, weight loss, age, sex, and smoking history to give a more personalized estimate of survival chances. In practice, determining prognosis involves a thorough review of imaging scans, biopsy results, and molecular tests. This comprehensive assessment helps guide treatment options, whether surgery, chemotherapy, targeted therapy, or immunotherapy. It also provides patients with an idea of what to expect, though it's important to remember that these are estimates based on population data. Every individual is unique, and ongoing advances in treatment are continually improving outcomes. For the most accurate and personalized information, consulting with an oncology specialist is essential. They can interpret all these factors in context and help plan the best approach for each person.